rover landed last Thursday, and its main goal, to look for signs of ancient microscopic life on Mars.
A local nonprofit leader is pushing for a major change in schools across the country. Tom is the author of Mental Health 101 for Teens and the founder of Reset Schools, a nonprofit that trains kids and teens with better coping skills for stress and anxiety.
Which we're all feeling right about now. Tom says his goal is to see mental health taught as a core subject at schools across the country. He joins us today to discuss his plan for changing the ways schools address the topic of mental health. Tom, thanks for being on the show.
Morning, Tom.
Hey, morning, Leanne. Morning, Todd. Thanks for having me on today.
Absolutely. Hey, in your book, you write about a teacher who connected with you when you were a teen and ultimately inspired you to work in the field of mental health. Tell us about that history. What was it about that teacher?
Well, back when I was a teen, actually much like today, mental health was thought of in the light of mental illness. And so if you did feel any level of depression or anxiety, there was so much stigma, you tended to not talk about it. We kind of still do that today. And I was one of those teens who would hold it in and pretend I was fine. But I had this great teacher, Mrs. Burdick, who could see through that. And she really connected with me. I got counseling. I started to see mental health as not just preventing something I didn't want, but adding something I did want in my life, and seeing mental health as a real positive thing. And really that changed my life.
I can see how. I mean,
Yeah.
just that perspective of looking at it as like your physical health, something that you want to take care of and be a benefit for you.
And I know that you've spoken to,
Right.
800 schools and conferences. Last year, your last in-person speech was March 10th, which is hard to believe. It's been a year. It was in New York, so the day before schools closed down, actually. And tell us what that day was like for you and what you've been doing since then.
So last year we had a conference in New York, and I was speaking in a gymnasium to 6 different middle schools that were gathered. They actually gathered at a community college out there, so we could fit them all in, and they were just stacked in there, side by side, shoulder to shoulder. Obviously, you couldn't even social distance. I think I remember seeing maybe 2 or 3 teachers wearing masks, but none of the students and most of the teachers weren't wearing them. And then the very next day, all schools were closed. And I really have a heart for these students who didn't even have a chance to process what was happening. They had basically the rug ripped out from under them, and all of a sudden they weren't even going back to school. One day they were in, the next day they were out. Mm-hmm. And I think as adults, we had a chance to process that. We watched the news, we watch the morning mix, we watch all these, we understand it's coming, but many teens didn't, and that really changed their lives. And so, since then, we've been all online doing virtual assemblies with schools, doing coaching with students, and really trying to get them to focus on the positive aspects of mental health that they can do wherever they are, even from your basement, like I am right here today.
Hey, and you have big plans for schools, and why you believe all students need this mental health training. Talk about what your goal is here in schools across the country.
Well, it is interesting, isn't it, that we got to a point in our education system where we said, more than just math, science, and reading, physical health is important. And we added a class called physical education, and that's required for students everywhere they take it, and it's great for them. And yet in schools right now, we don't require mental health education. Mental health in schools is very reactive. So there's the ratio right now is about 1,400 to 1, 1,400 students to 1 school psychologist, and that's about 500 to 1 school or students to school counselors.
Oh my!
Now, again, that ratio it seems really out of whack, and they're really not even able to keep up with the students who are struggling with behavioral problems or struggling with mental illness, and kids who need more of that one-on-one care. And so what I'm saying is, what about the other 80, 90% of students that could use some positive mental health skills? And I think, especially during this time, we could all use some positive skills like resiliency to make it through these times.
Absolutely.
Absolutely. And you have a book out real quickly. We're kind of running low on time, but go ahead and plug this book, Mental Health 101 for Teens.
Yeah, thank you for putting it on the screen there. Actually, I have a copy of it here as well. This is a book that we wrote with 3 people from our board of our nonprofit group. And we have Dr. Curleen Neely from Texas, and Dr. Kimberly Hoog, also from a different part of Texas, and then Dr. Elliot Kagan from New York. And the 4 of us partnered up to try to bring a book that would be for all students. We're actually developing a teacher's guide right now that goes with it, and a video curriculum, because we want to see this taught in schools. We want students to know that they're not alone, that their mental health is just as important as their physical health. And so we're bringing a book that talks, probably about 80% of the book it really is about these positive skills we can all add in our lives. And we're bringing that to schools across the country.
And you have something for the parents and teachers too, a free download. Quickly, 7 tools for reducing anxiety.
Yeah, this is a free tool. Even if people aren't able to pick up our book, they can go to our website, mentalhealth101.org, and download this print off. It's about 8 sheets long, and it has 7 tools for reducing anxiety, including a support system checkup, a self-esteem checkup. And we give all of these calming resets and boosting resets, giving kids ideas of how they can reset their mind, reset their hearts and attitude. I always say to our own kids, my wife and I have 4 kids, I say, look, even if you started out the day on the wrong foot, got up on the wrong side of the bed, you don't have to end the day that way. And so we all need these tools to be able to reset, to reduce that anxiety, and build that positive momentum in our lives. So I encourage you, mentalhealth101.org. You can get that free download and use it with your own children at home.
All right.
Perfect. Thank you, Tom. Appreciate it.
And once again,
Thanks for having me on today.
Absolutely. Mentalhealth101.org. We'll have all the details on our website later today.